I'm Dr. Paul Danielson. I'm the Director of Pediatric Surgery and Trauma here at All Children's Hospital in St. Petersburg, Florida. Our hospital is located on the west coast of Florida, which puts us in Hurricane Alley. And perhaps the only silver lining that came out of Hurricane Katrina several years ago is that we learned a lot about how hospitals should prepare for a natural disaster like a hurricane. In our new hospital, which will be opening in December, we spared no expense in incorporating the technologies and the lessons learned from Hurricane Katrina. Some of these would include having a completely state-of-the-art, self-sufficient power system that creates electricity, compressed gas, and water such that the hospital can run by itself for 2 to 3 weeks. As a pediatric trauma center, we're used to getting referrals from all up and down the west coast of Florida. And in times of disaster, we're prepared, in our planning, we plan to have to accept patients from the communities surrounding us. You know, one of the things we did at All Children's is we made sure that the new hospital was on high ground. The other thing that we considered when planning the new hospital is that many of our sickest children are not going to be able to be evacuated in time of a disaster. They just can't be put in a helicopter, they can't be put in an ambulance, they need to stay put and ride out the storm. So we actually are prepared to actually surge to full capacity and beyond in time of a disaster, whereas many other disaster plans at other institutions rely very heavily upon evacuating the patient load. From my experience being deployed overseas with the Army, one of the first things we learned is that when you have to equip a unit or a medical facility for taking care of trauma victims or disaster victims, you have to include the kids, not just the adults. And it's not just a matter of having things that are smaller in size. And when we planned the new hospital, that was our emphasis, to make sure that we had all of the state-of-the-art pediatric supplies, technologies, and equipment available to be ready in case of a disaster.